So they have two groups, healthy average weight individuals. Group 1, each normal diet, but every day for 5 days, you're going to eat 1,500 junk calories. Highly processed, high calorie, high sugar. After the 5-day eating binge, so just 5 days, they found significant reduced insulin sensitivity or increased insulin resistance.
In 5 days?
In 5 days.
This is Generation Health. We bring you the latest news, cutting-edge research, and time-tested best practices, helping you live a longer, healthier life. Today we're talking about the brain. Scientists at the University School of Medicine have been able to document something amazing. By looking at MRIs of the developing brain of both unborn babies and those just a few days old, they were able to chart what areas of the brain develop and interconnect first. The research was published in the journal PLOS Biology, showed that while the various regions of the brain are developed and present in the womb, it's the actual birth process that instigates a radical increase in the number of connections between them. In particular, the subcortical network saw the most interconnections developed. This makes sense as it acts as a central hub, relaying signals in and out of the various parts of the brain. This research is still in early stages, but by having a clearer picture of the normal process of development, we can also begin to understand what's happening when things don't go as planned. Situations like prenatal trauma or premature birth are known to have significant impacts on brain development. If we understand what ought to be happening, we may be able to develop new ways of intervening and getting things back on track. And even if your neurological development at birth went exactly as designed, that doesn't mean that you can't mess it up later in life. New research published in JAMA looked at over 1,000 young adults and documented exactly how much both recent and heavy lifetime cannabis use impacts various aspects of working memory. Working memory is the ability to retain and use information to perform tasks like following instructions or mentally visualizing and manipulating information. It's what you're using when you read a phone number and then dial it or follow the directions that the waiter just gave you to the bathroom. It's fast and it's short term. And while the results aren't exactly shocking, it is worth noting. MRIs were used to watch brain activity as participants completed 7 cognitive tasks designed to test language, motor skills, emotion, reward, and working memory, 5 different functions of the brain. No real differences were found in those first 4, but the last one, well, 68% of those that reported recent cannabis use showed a reduced ability during those working memory tests. And of those who were considered heavy lifetime users, 64% displayed the same problems regardless of when they had last used. If you needed a peer-reviewed journal to tell you this, well, you've obviously never watched Scooby-Doo, but it does serve to reinforce both the short-term and long-term consequences of cannabis use, especially for young people whose brains are still developing. Joey, you texted me a link the other day, as you often do. You send me fantastic links about different things. And this was one of those articles that I read every single word, and I understood about a third of them. So help me understand. This article is on Pharmacy Times. It says, study finds rapid dietary effects on brain insulin and obesity risk. First of all, I didn't know the brain had insulin. I thought that was only in muscles. I guess
peripheral. Yeah. Basically we always think of insulin, and it's true, receptors as being everywhere.
Okay.
Yeah. So the link to brain insulin and insulin sensitivity in the brain is definitely, I don't know how new it is, but it's definitely the new angle, not just for blood sugar regulation related to diabetes, but also just for obesity and weight management itself.
Okay. Yeah. Because theoretically, my understanding is that the body gets signaled, hey, there's blood sugar, you should absorb it. And then the muscles and other tissues, I guess, absorb the sugar out of the blood, the glucose out of the blood, and use it for energy and various other things.
Correct.
And so I guess that makes sense that it would be in the brain as well.
So I guess it's kind of 2-part. So insulin is the is the result of that signal.
Right.
Okay. So insulin takes the glucose from the bloodstream and allows the cells to utilize it. That's what gets glucose into cells. So that occurs in the brain because the brain needs glucose.
That makes sense.
But what's interesting is that that's not all that's going on there. And we'll get into it a little more, but there has to do with the overall management of food satiety, et cetera, blood sugar regulation that occurs from the signals from the brain, not just from the direct action of glucose pulling, insulin pulling glucose out of your bloodstream into your cells.
Why do I feel like this is somehow related to the GLP-1s and all that conversation?
And to some extent, yeah. This is where it starts to kind of pile on and. Yeah, so we kind of went over what insulin is. Insulin sensitivity is the body's ability to effectively use the hormone insulin.
That's a key word.
Yes, the effectively, yes. So when it's sensitive, that's what you want. That means that less insulin is needed to get your glucose level down to pull it out of the bloodstream. When your body becomes resistant to insulin, just like it sounds, it's going to require more. It's going to require more to help pull that into the muscles and get it out of the bloodstream. So it's critical for maintaining healthy blood sugar levels, preventing type 2 diabetes. Okay. When you do get insulin resistant, you're at a higher risk for high blood sugar. In short term, type 2 diabetes, metabolic syndrome. In the long term, cardiovascular disease. And
this is it's a downward spiral, correct?
Exactly.
Like when you become insulin resistant, it typically just gets worse and worse.
Yes. So insulin resistance can be caused by various factors: obesity, physical inactivity, unhealthy diet, stress, even certain medications and genetics. So the medications and genetics, a little more difficult, a little more isolated, but the obesity component and kind of the chicken or egg aspect there that develops, and we'll go into that a little bit. Physical inactivity, often whenever you're gaining weight, you're becoming less healthy, you're stressed, you're not eating well, you're less likely to work out. That whole chicken, egg, pull, push.
Like they all go together.
Mm-hmm.
Wow. All right.
Yeah. So the brain is an insulin sensitive organ, like we mentioned, just like all the peripheral parts of your body that are. Okay. So, but it also plays a vital role in not just brain functioning, but also your metabolism. Okay. Your cognitive processes. And the key thing here that I found really interesting is the ability for your body to regulate glucose metabolism, send those signals, maintain your energy levels. So it's not just what it's doing for the brain itself as the organ who needs glucose, but it's the signals and the interplay with the rest of your body.
Oh, wow. That makes sense that the brain is the source of that signal. Okay.
Yes. So insulin resistance in the brain, just like in the rest of the body, it's when the brain and the cells and the receptors fail to respond as effectively as normally to insulin. What also that can lead to, though, is cognitive decline, age-related memory impairment, potentially even neurodegenerative diseases like Alzheimer's. So it's not just the weight gain, it's the impact of insulin resistance in the brain because of what your brain needs. So no, we're going in two different directions. It's how does insulin resistance in the brain impact the brain itself and what the brain does related to cognitive decline, memory impairment, neurodegenerative diseases, but then also how does it impact the rest of your body, weight gain, type 2 diabetes, because of the signals that are being sent improperly.
Man, okay.
So this is not meant to be a deep dive on that, because it's complicated and we've touched on it before. But what this study looked at directly is short-term. I mean, they didn't use the word binges. I've used it in here a few times, but short-term bouts or binges of excessive caloric intake. So they have two groups, healthy average weight individuals. Okay. Group one, eat your normal diet, but every day for 5 days, you're going to eat 1,500 junk calories, highly processed, high calorie, high sugar for 5 days. So they'll measure you. They use MRI to actually measure in the brain and also liver fat, which we'll get to. But they baseline after 5 days of this binge. And then also, which is really interesting, 7 days after you've resumed normal eating.
Okay. So for 5 days, you're eating 1,500 extra calories of junk food.
Yeah, it's basically was set up. This is not a diet change. It's eat like normal, but
you went on vacation.
Once a day, you're going to come in and you're going to hammer some Snickers and yes.
Okay.
So, but then again, they're gonna look at you again after 7 days.
7 days after you stop doing that.
After you resume normal eating.
Got it. Okay.
Group 2, no changes. You're just going to be evaluated at those same benchmark
control
dates. Group. Yes, control group. Thank you. So they're using MRI to assess brain insulin sensitivity and also liver fat content.
Okay.
So what they found, and it's a small study, but it's still very interesting in terms of what, as we're trying to piece together all that's going on here. After the 5-day eating binge, so just 5 days.
Yeah.
They found significant reduced insulin sensitivity or increased insulin resistance.
In 5 days.
In 5 days. And it was to levels seen in obese patients. So again, obese patients typically have had this process going on for an extended period of time, and their levels of insulin sensitivity are similar to 5-day eating binge.
So you're saying that for these people, if somebody engages in a binge like this, that if the effects on the brain are going to be similar to what somebody experiences, whether they binged or not, of being obese.
Yes.
Wow.
Yes, because of the
process. Which is a very long process.
Yes, because of the process that has led to them being insulin resistant goes hand in hand with being obese. And
wow.
Yes. Yeah. So after 5 days, again, insulin sensitivity reduced to levels seen in obese patients. But what was even more interesting, or just as interesting, they remember after a week, they were going to reevaluate you again. So back to normal eating, they had not returned to their baseline levels yet after a week of normal eating.
Oh man. So it's okay.
So the liver fat, interestingly, they didn't compare it to obese levels or anything. They just saw it. It went up. Liver fat increased after 5 days. After the week, went down.
So the liver repaired itself.
It repaired, adapted well. The insulin resistance in the brain did not.
Oh man, that has profound implications for what it means to radically alter your diet, even for a short period of time.
Yes. Yes, not just for your brain functioning, but for the overall process of maintaining the blood sugar, of gaining weight.
Yeah.
The study authors concluded that this rapid, significant disruption of brain insulin sensitivity after 5 days may even be the initial cause of obesity and type 2 diabetes, even well before any weight gain is noticed. What I liked about the study, again, it's small and more study needs done. But the MRI evaluation adds some hard data to this. Okay, that's for sure. And I also like, again, linking and trying to better understand the role that brain insulin plays, not just in the functioning of the brain related to cognitive issues, but also in the regulation of appetite, feeding behavior, energy balance that we do kind of get into when we look at the GLP-1s.
Yeah.
So I think... and again, what would happen if they tested them a week later? It didn't continue to go on. So this is not saying that at day 8 it was normal. We don't know. That's all they tested. 5 days, 7 days, no more. So we don't know kind of how long. That would be interesting to know.
At some point, it returns.
Absolutely. And yes, 1,500 is significant.
It's a lot.
Yes. So especially because it's just added to normal diet. I don't know, what is that, 5, 6 Snickers bars? It's significant. But when you look at, even just being honest with myself sometimes, the way that, I don't go on these 5-day binges, but there's periods maybe where you're not eating as good.
Yep.
And so when you look at just how the process works, it may not necessarily take, it's not the magic number of 5 days and 15. What if it's 2 days a week?
Yeah.
I tend to sometimes not eat real good on the weekends.
Yep.
But so you have that intermittent consistency though of what could potentially be affecting insulin resistance in the brain.
When it makes sense that if it's affecting your brain that way for that long, that a little bit of misbehavior continued just a little bit will have downstream effects that it makes it harder to get back on track, to refocus and recenter and do things the way that you should be doing it.
Exactly. Well said. Yes. Yeah. And then back to it again, I think, again, maybe because it's personal, but kind of the weekend kind of, work hard, play hard.
Yep.
Sometimes eating on the weekends, letting things go. It doesn't mean that you can never do those things. There's no magic number about what caused it, or one day. It's not about that. But if it's consistently 2 times a week, 8 times a month, and you're eating maybe an extra 500,000 calories every time, maybe it's not going to be 5 days where you notice it, of course, but over time, it shows that potentially there is some accumulation effect in the brain that's not only going to affect your peripheral cells, not only going to affect your brain functioning, but affect the way that your brain helps to manage those things and manage your weight.
And that's really the part that I think is most interesting, is that you're talking about, for these folks, it becomes harder your brain feels less satiety from what should be a normal meal than it did previously.
Yes.
Which then drives the bad behavior of going to seek even more calories.
Yes. And it goes back to some of the discussions we've had. Obesity is a disease, but kind of what caused it, so to say.
Right.
Yes, there's genetic, and yes, there's certainly those things come into play significantly. But their ultimate conclusion was to kind of say, hey, this could be kind of how that process starts. And then, like you're saying, once it has started, it's a vicious cycle. It's continuing to perpetuate that.
Man, that is horrifying and wonderful. I'm glad we're discovering these things.
I hope they do I hope they do another study like this, a little with more patients, and maybe test after 2 weeks, a month, and just see what occurs. And yes, it's really tough to control for the diet. Who knows? Maybe these people in that 7-day window where they resumed normal eating know they didn't go and get their 5 Snicker bars on the house, but maybe even in that short period of time, it did spark some things.
Maybe it was 2.
Maybe they eat a little worse. Exactly. But that's part of the point,
right?
Is that whenever you do expose yourself to those things and you do eat that way, you do expose your brain to it, what it does to you the rest of the time in terms of what you want, what you crave.
Well, I was going to go get some ice cream when I left here, but I guess I'm going to eat the rest of the celery that I have in the fridge. Oh, goodness. Thank you, Joey. Anything else on that before we move on? All right. That's quite enough out of you, I think. Thank you. All right, Joey, we're going to talk about one of our products again. I do love doing these. This is kind of funny because this is the second time we've done this. We did one of these for the old version of this product.
Yeah.
And before we were able to release it, we came up with a better, newer version.
I think it was a couple weeks before we officially changed it over, or we started discussing changing it over, that we did this.
Yeah, so I'm glad we caught it before we published it.
I had a lot of my prep done already, so that made life a little easier for me.
Oh man, we are talking about Iron Advanced Essentials. This is a relatively new product, obviously, to the lineup, but it is in place of an older product.
Yeah,
it's an improved variation. Tell me about this product, Iron Advanced Essentials.
Yeah, so Iron, this is our first, like we said, it's the first update we've ever had on the Iron product. Again, this is not a quantum leap. This is an update to the product that we've never done before. So when you're talking about iron supplementation in general, there's a lot of nuance and detail. This video is not meant to discuss the ins and outs of ferritin levels and what the different levels mean and things like that. That's more of a deep dive subject.
We've done episodes on that in the past, I think. And so if not, we can do it again.
Yeah, today, this video is mainly a discussion. You've been diagnosed. You've been instructed by a practitioner to take oral iron. This is not about the infusions either. That's a whole nother level. And I think one thing too, and why I felt the need to mention that, is that anytime you're dealing with a supplement that has legitimate, but is clearly associated with fatigue and energy, we'll get into some nuance a little bit later, but just generally speaking, fatigue and energy is linked to iron. I relate the way life is today. Yep. Tired, energy, fatigue. So people jump right in. I want to try iron. I want to try B12. In this case, with iron specifically, it's measured in the blood and it's critical to maintain it within levels. So this is not like, oh, iron is so great, we all need to take it, like maybe like an omega-3 video would be, or a probiotic would be. This is, you've been diagnosed, okay? There are a couple exceptions to that broad statement for women. We'll get to those. But yeah, long-term excess iron, not just nausea, stomach pain, diarrhea, but long-term, you can get liver and organ damage. They've even found prolonged excess levels lead to an increased incidence of colon cancer. So it's not something to play around with.
Yeah. So this is specifically for people who are low in iron, which is a blood test that can be done before you should probably start taking this.
Got it.
For most people.
You got it.
Okay.
So maybe your doctor has, a practitioner has told you to take 1 or 2 iron, just over-the-counter supplements. Ferrous sulfate is typically what you would get. What do you do to navigate that? Why maybe is there another option compared to just popping into your grocery store and grabbing a bottle of iron? So first of all, iron, yes, is a metal. And in our body, though, what's important here is how it translates into human physiology. Also, the interplay with food and supplement intake, and just a little more about that. Iron supports prenatal and cognitive health, and critically, like we mentioned, iron balance, okay? It's a component of the proteins that are involved in oxygen transport, okay? So hemoglobin, myoglobin, ferritin. Basically, hemoglobin is what carries oxygen from the lungs into various tissues and organs. Ferritin is how your body stores it to be able. So again, that's where it goes back to some of the measurements and things like that. Gets a little complicated because some of it you're looking at storage, active iron, etc. To what we typically see with the average adult, issues related, if you have a symptom, if you're purposely getting checked for it, it's related to that energy balance component. So in food, iron, like a lot of the supplements we talk about, hence the name, there are nuances in terms of how we take in iron from our diet. There's heme iron versus non-heme iron.
Okay.
All right. In the most broad sense, you can think of heme iron as the most absorbable form of iron. That is the closest step to the ultimate goal of iron being a part of hemoglobin. Remember, it's not just iron floating around in our blood. It's how our body takes the iron. It's a key component to making hemoglobin. Non-heme iron is just kind of the iron itself in ionized form. So again, the heme iron is what you'll find in red meat, poultry, fish, and that's the one that you're going to get closer. It's a step closer to the production of hemoglobin. Non-heme iron is found in plants and eggs. Okay. Heme iron is absorbed at 35%, non-heme iron 17%, so about half. So back to the energy balance, okay? So iron supplements are often a standard recommendation following blood work for treatment and fatigue. So I do want to emphasize how important it is. There was a French study done in 2012, 200 menstruating women ages 18 to 53. Otherwise, blood work was healthy, but complained of fatigue. They had low ferritin. Half of the subjects took it, the other half took a placebo. So a well-designed trial. Fatigue was measured using a questionnaire, and it was blinded. At the close of 12 weeks, they found significant improvement in the non-placebo group, in the iron group. So we know that when those levels move, if that's all that's going on, iron makes a huge difference.
Very cool.
So in terms of supplementation of iron itself, you'll look at a bottle, your doctor say, take a ferrous sulfate 325. One thing that's important, and then maybe you'll look at ours and it says 29. You're like, oh my goodness, like what is going on there? So ferrous sulfate 325 is the total weight of the ferrous and the sulfate components, okay? The amount of actual iron, if you're looking at that label that's in more of a fine print situation there, is 65 milligrams. So yes, you get 65 milligram of essentially non-heme, not very well absorbed iron in a traditional ferrous sulfate. That's what you're going to find on the shelf. Ours contains 29 of actual heme iron or something close to that, something that functions the same way in the body in terms of absorption. So you're not comparing 325 to 29. You're comparing 65 to 29. So it basically, if you've been told to take one of those tablets, take 2 of ours. That's the most simplest way to look at it. It also does provide flexibility in dosing. Maybe your level's coming up and your doctor has to decide between taking you off or on. You can cut down to 1. You can maybe go from 2 to 3 if the levels aren't moving. You have a little more flexibility given the strength.
Okay.
So yeah, related to dietary intake, a serving of chicken, 1.8 milligrams, steak, 6 milligram. And again, those are both heme forms. So you often associate red meat with iron, and that's certainly true. You're going to get a significant amount from chicken, but still not at a red meat level.
Yeah.
Eggs, 0.6 per egg.
And that's non-heme.
Non-heme as well.
Wow.
Yes. Now, who's eating 1 egg? Anytime we talk about these kind of things,
sure,
whether a supplement or mainly with food, it's the serving size that's important. But you're starting.
But you're not eating 20.
Exactly. Yes. Serving of beans, which we're definitely not eating even 3, 4, 5 of those. Right. 0.6. Spinach, wow. 0.8. And like you brought up, it's more poorly absorbed. So from right there, this is not a pro meat, pro red meat, but just be aware. The facts are, if you're a vegetarian, you're consuming less iron on average, and then from there, you're definitely consuming the non-heme, not as absorbed form. So it's particularly in menstruating women. It's just something to be aware of. Related to, even if it's not fatigue or you haven't had the blood work done yet, to maybe get that checked if you're dealing with that.
Okay.
Males are recommended, depending on age, 8 to 11 milligrams of iron daily. Females of reproductive age, so from adolescence through menstruating years, is 18 milligrams.
Okay.
So women certainly have the higher demand due to menstruation.
And that's just because of blood loss?
Yes.
Okay.
Yes, and the need to produce
replenish that.
Yes.
Okay.
Yes. So I think one thing that's important to understand as well, especially again when we're dealing with supplements that are recommended to you, is what are the other factors that may inhibit absorption? How am I, 25 not low on iron and I'm 32 and I'm low on iron? How does that happen? So a few different kind of explanations for that are tea, coffee intake, chocolate, even certain fruits. They're not, diminishing your iron stores, but if they're taken in at the same time as the food, if you eat the red meat with a bunch of fruit, coffee with your et cetera, you are inhibiting the body's ability to absorb iron at that point.
Okay.
Calcium. A lot of times, again, we see an overlap. Somebody needs a calcium supplement. Maybe they're at the age and situation, they know they need iron as well. Well, they take everything in the morning. Basically the way the body absorbs those minerals, you're going to cut down the absorption of both.
Wow.
So whether you're supplementing it or you're taking your calcium with meals, which is recommended, just be aware that can throw off the iron level as well. Zinc, similar thing, be the same mechanism.
So ideally you want to take those at different times?
You just want to be aware.
Okay.
Yeah. So it really depends. Calcium and iron supplementation that's been recommended to you. Yes, definitely at both times. Something like your diet and things like that may only be an issue if you're not getting movement, if you're trying to figure out maybe why something happened, just a little background. But yeah, the more actual recommendation would be the calcium and iron for sure.
That's what I meant. Yeah. Okay.
Yes. Right. Just wanted to differentiate. Medications as well. So again, what else could change that could cause that to happen, or what else makes you need a higher dose, et cetera. Antacids. So definitely the calcium, magnesium kind of TUM style, immediate antacids, as well as PPIs, proton pump inhibitors that are used more long-term for heartburn and acid reflux. They reduce stomach acidity, and acidity is necessary for iron absorption.
That makes sense.
Coffee, tea, alcohol, also certainly GI conditions, celiac, Crohn's, could all affect absorption.
Okay.
So anemia, advanced essentials is the bisglycinate form of iron. So again, you're not just ferrous sulfate. The iron has to be bound to something. It's bound to sulfate in that case. In this case, it's bound to bisglycinate, a more highly absorbed heme form of iron than ferrous sulfate. 59% studies have shown higher absorption than sulfate.
Wow.
The other related to its absorption and just the way that the body handles it, it's very common to get GI side effects from ferrous sulfate: stomach discomfort, heartburn, loss of appetite, constipation, darker than usual stool. The sulfate form is pretty hard on the gut. The bisglycinate form is very easy on the gut. So first and foremost, what is the difference between this? And besides all the details I've laid out, if you are taking ferrous sulfate and you're having some stomach issues, consider a switch. It's not about stopping iron or skipping it. It's about there are other options for you.
That's fantastic. All right. How many do people normally take? I guess that depends on what the doctor's recommended.
So you can always remember kind of the double rule here. If you've been told to take one standard tablet, take 2 of ours. If you've been told to take 2 standards, obviously then you go to 4. But there's flexibility in between. The one nuance I do want to mention to kind of how we open this is that for women during menstruation itself, not just menstruating women, but during the period, they already, again, are starting with a higher RDI, recommended amount than men. But especially if your menstruation's on the heavier side, something like a few days of the heavier bleeding may be beneficial to take 1 a day during that time. And the reason is not just for the obvious that, that there's a loss, but that it may not reflect in blood work. If you're going through a 28-day cycle and there's only an issue during 5 of those, and then you're checking blood work, things like iron storage may not purely be affected, but during that period, especially if you are feeling fatigue, that can be more of a short-term kind of boost to you energy-wise. Again, if you're on the heavier side, maybe your blood work's coming back normal.
Yeah,
that could be why. Because again, it's relegated to that amount of time. The other nuance is pregnant women. In fact, the CDC recommends low-dose iron supplementation beginning with your first prenatal visit.
Oh wow!
So yeah, I would recommend get your level checked. Because again, it's very important in prenatal development. But even just this would be the one time, kind of just at a baseline, you could start taking 1 of these a day at the beginning of pregnancy.
And again, there is a consequence to having way too much iron in your blood.
Yes.
So we're not saying everybody should be taking 5 of this. Those are very specific use cases.
Exactly.
Okay. That is fantastic. I'm glad to get this done. I'm even more excited that we are keeping up with the latest and best with these products, making sure that they are top notch, always on point. If you would like to learn more or find this product, you should do so at our website, askjoedimatteo.com. That's askjoedimatteo.com. That site has the Iron Advanced Essentials as well as all the other products that we sell. You should go check them out there. Joey, thanks so much.
Thank you.
That's it for us this week. If you have a question you would like answered, please email it to us. Questions@askjoedimatteo.com. That's questions@askjoedimatteo.com. That site is also where you can find out more about this show, the past show, and find all of the products that we talk about on the show, all there on that website. Big thanks, as always, to everybody that helps make this show happen. And if you learned something, please share it with somebody you know, somebody that could also use this information. That is the best way to help us grow. Have a great week. We'll see you again soon.